people who are using, whether it's abortion or a supposed death panel, those are people who are using abortion as cover for opposition to healthcare.
This is Faith Complex, hosted by Professor Jacques Berliner-Plau of Georgetown University.
Hello, my name is Jacques Berliner-Plau of Georgetown University, and you're watching Faith Complex. Joining us today is senior editor for Time magazine, Ms. Amy Sullivan. Ms. Amy Sullivan is author of The Party Faithful: How and Why Democrats Are Closing the God Gap. Ms. Sullivan, thank you for coming to Georgetown today.
It's a pleasure. Thanks for having me.
Have you heard anything about this, healthcare debate? Have you heard about this? There are many physicians that would make the argument that healthcare constitutes something of a human right. Is healthcare in and of itself a human right?
Even if it's not necessarily a human right, there are a lot of people making the argument that healthcare is a moral issue. And certainly that's what you're hearing from a lot of the religious groups that are involved in the lobbying in support of healthcare reform.
In support of, right.
Yes. And in fact, it's a phrase that you heard President Obama use in his address to Congress just a few weeks ago, quoting the late Senator Ted Kennedy saying that this is a moral issue. And that's the language that's been used a lot, and it's been used even by leaders of the Catholic Church.
Right, so we shouldn't look at the Catholic Church as categorically opposed to any form of healthcare reform. That would be an error.
Oh, far from it. No. In fact, the bishops have been calling for universal health care for a number of decades now. For them to come out and state that this is a moral imperative, in fact, Archbishop Wuerl here in Washington thinks that healthcare reform needs to cover immigrants, whether they're legal or not. Now, obviously, we're not there.
Is the right wing, and let's assume these are opponents of healthcare reform, are they couching their counter-arguments in religious terms, as far as you can tell?
Not necessarily. I mean, the large sticking point for many religious Americans is whether abortion will be covered.
Was there an effort on the part of the Obama administration to not let the abortion issue crawl into this one, knowing how divisive it is in American politics?
This seems to have been a debate that they didn't quite see coming, or if they did, they weren't sure how to head off.
So here are some statistics for you. Nearly 45,000 people in the United States die each year because they lack proper health care. The United States ranks 50th, somehow, 50th in length of life. It strikes me that healthcare reform is a life issue, and pro-life forces should be interested in getting on the bandwagon, but apparently they're not. Why is that?
Well, that is actually the argument that many Catholics make of why they support the idea of universal health care. And again, I think it's important to keep in mind that there are a lot of supporters of health care reform who have been holding back specifically because they aren't sure how abortion is handled in this particular proposal that's up on the Hill. But they are potential supporters of a final effort should they have their concerns about abortion taken care of. And it's in fact the very reason that a lot of Catholic bishops are starting to refer to themselves as whole life, not just pro-life. And their argument is they are opposed to abortion, but they also believe that you should provide for the whole, what Cardinal Bernardine used to call the seamless garment of life.
And what distinguishes a professor from a journalist, well, there are a variety of things, but you journalists actually go out there and see people and speak to people, whereas for us it's a little more abstract and theoretical. So these town hall meetings, the irate conservative columnists, who are they religiously speaking? I've yet to see a journalist tackle that. Who are they?
Well, that may be because they span the religious spectrum, and it doesn't define their opposition to health care necessarily. It's important to know that there are people who are using, whether it's abortion or supposed death panels or anything else that has come up in terms of, the idea that this is some communist system. Those are people who are using abortion as cover for opposition to health care.
Now, my surmise was this was kind of a flume generated out of the values voters of 2004. So perhaps I'm mistaken. Is there a correlation between having been a values voters, watching John McCain, the GOP, losing in 2008, and picking up your placard and your bullhorn and heading out to a town hall meeting? Is there any correlation?
Not necessarily, no. In previous iterations, what we've seen is there's actually not a lot of difference in terms of support for healthcare reform within religious categories. Now, it may be that this specific debate and the fact that it's a Democratic president who has put this as one of his number one agenda items. Maybe that is driving some of the opposition.
The second thing I'm learning from you is that the Democrats were really off message on this one, and there were a variety of tactical errors that were made all along.
When the concern about rumors about death panels started to come up, everybody in Washington, at least, whether they are being honest about it or not, understands there are not death panels in healthcare reform. Instead of saying, absolutely, we are not talking about euthanizing people, they would say, well, we're giving people the choice. The language of that was just concerning. I think the White House could have come out and just said, absolutely not. We're not talking about euthanasia. We are talking about end-of-life care, which includes all of these other things.
In your reporting for Time Magazine, which we've been following very carefully, you've been generally critical of Republican criticisms of the Obama health care package. Are there some moments where you look at some of these criticisms and you yourself say, well, that actually is valid?
Well, certainly the way that abortion was handled in the original proposal was extremely vague, not laid out. So when you heard people on both sides kind of interpreting the language for themselves, they were both right. Now we're starting to get a little more specific language. The president has come out and said that he would support explicit language ruling out the use of public funds to pay for abortion. And so now when you hear some of the pro-life critics of the plan say, well, that doesn't mean it, he's not going to stand behind it, it's a little hard. There's not as much proof for their arguments as maybe there was in the beginning.
Okay, here's some statistics. Estimates show that 27% of Medicare's annual $327 billion budget goes to care for patients in their final year of life. You mentioned the term euthanize, and here I'm going to channel my inner non-believer, my inner atheist, and I'm going to ask you, is there something about the way we religiously inflect every single discussion in this country that is preventing us from facing what we might call the cold, harsh realities, that at a certain point, life might not even be worth living?
It has been surprising to me since in much of my reporting come across evangelicals for whom this life that we live here is definitely seen as just temporary. I mean, this is kind of core to evangelical theology, that this is a life so that you can get to eternal life. And in fact, in many evangelical cultures, funerals are seen as more, if somebody has lived what is seen to be a full life, as a reason to rejoice in someone
You're stepping up.
Going on to heaven. Exactly. And so it's a little unusual that we have focused so much on trying to hold on to the life that we have here. I would say there is something about the national discourse. I wouldn't necessarily pin it on religious voices. We do need a national conversation maybe about the quality of life, what it means to live as much as what it means to die. And that's precisely what some of these provisions in healthcare reform are trying to get at.
So when you file stories in 2010 at the midterm elections, what do you think you're going to be writing about as we look back at the summer of 2009?
I'm not sure healthcare actually is going to matter that much. It will certainly be brought up by both sides, some claiming credit, some pointing the finger of blame. It may be more likely, and in fact very likely, that we will be talking about the economy still. It was the issue in 2008, and it will be the issue again in 2010.
Amy Sullivan, author of The Party Faithful and intrepid Time Magazine reporter, thank you so much for explaining this all to us.
Well, thank you for having me here.